Hey everyone, this is Frank Garza here again with Pure Physical Therapy, and just following up. Hope you got something good out of last video there on the step down test. What I want to do here today is show you that Robert Griffin III jumping assessment that I talked about, and explain it to you, and so that you can see. Basically, this picture here is titled "How Poor Knee Mechanics Leads to Injuries," which I think is a pretty good title or description for this photo. So what I want to do is walk you through this. So this is Robert Griffin III, and he's going through, I believe they're either doing a tuck jump or a squat jump. Regardless, the alignment in that should be hip over knee, knee over ankle, all the way, or at least throughout most of the squat and the jump. And as you can see here, as he gets deeper into his squat, his knees cave in, okay? And the deeper he goes, the more caving. And then on the way up, they're still caved. So a big indicator here for us clinically that leads us to believe that we need to look at something to correct that and train properly, specifically to strengthen the other muscles that are supposed to do the opposite of that action, and possibly keep this kid from participating in jumping and landing activities, because this is one of the things that we look at and we go through when we do our pre-test and pre-exam, and to identify these possible future injuries. And then of course we put a specific treatment plan for that person. So if you have your son or daughter doing a lot of jumping and landing activities and they're not looking at his mechanics, then I would stop and take a look at his mechanics. And if something like this is happening, you definitely want to get him into a physical therapist where we can retrain that body to get back into proper alignment, so that we can avoid abnormal stresses like this, which in turn would then avoid future injuries. So hope this is helpful. Again, big area where can get overlooked or maybe ignored. I think in his case, he was trying really hard to get to the NFL, and he was at this point, and maybe this was never addressed. Who knows? And of course, we know his story with his multiple knee injuries and his inability to be able to play. We want your son or child to play, and that is our main focus and goal. So this program is tailored in first identifying if there is a possible problem, and if so, taking care of it and handling it before it gets worse. So if you have any questions, concerns, please don't hesitate to email me back. Look out for the next video where I'll probably talk about another balance test that we do in the clinic. And then we'll see you at the workshop. Thank you. Have a good day.